part 2, picking up with breast cancer and risk factors you can't change. So just basic genetics, and it's important to point out here that 1% of breast cancer cases do happen in men. So, 99% of the cases are women. So genetics, there's the usual family history that there's somebody, and they'll refer to as a first degree relative, like your sister or your mother, that has breast cancer, but no quote unquote breast cancer gene. And then there's the BRCA gene 1 and BRCA gene 2, where these are known breast cancer mutations specific that drastically increase a woman's risk for having breast cancer. And as you're may have seen from your research, ovarian cancer as well. And it's such a high increase in risk that a lot of women have discussions with an oncology specialist about having preventive mastectomies in some cases. So it's actually a very serious thing. If a woman has early onset of her period or has late menopause or is taller than average, and the supposed link here is either extra years of estrogen exposure or higher estrogen levels. That's kind of the mechanism that is postulated. Just age. So if you're older, your risk of having breast cancer goes up. Exposure to other carcinogens, or if you had radiation to your chest, like if you had lymphoma and you had radiation therapy to your chest area, that's going to increase your risk of breast cancer. And then other other non-carcinogen changes to your breast. So if a woman had during a mammogram, they picked up cystic breast changes that weren't cancer, sometimes some of those changes go along with a higher risk of having breast cancer, and I'm not sure why. Things that you can change, avoiding alcohol, if you're overweight or physically inactive, and some of that goes with as people age, some of your fat tissue gets converted into other hormones, and so that might be an estrogen link as well. If you have used birth control in the past, and that sometimes depends on the form of birth control. Hormone replacement therapy for women that have been through menopause or have had their ovaries removed for treatments for other cancers. That's so much so that a lot of gynecologists won't even go down that road anymore. Differing effects of childbirth, number of children a woman's had versus when you've had them. And so there's conflicting data there. And then if you've had a child not breastfeeding, can increase your risk of having breast cancer. So signs and symptoms. So these are a lot going to be local symptoms, and that makes it a little bit difficult because it's not always easy to pick up. So a lump or unusual swelling in a woman's breast or chest, a retraction, that means like a puckering in of the skin where the skin kind of looks a little bit indented, discharge, pain, or sometimes what will happen is if you've got a woman who's an athlete or is doing something with her children and gets hit to the chest by like a ball and you get swelling there that persists a lot longer than it should be, that can be a sign, or swollen lymph nodes in the armpit. So incidence, prevalence, and mortality. There's a little bit over 124 new cases per 100,000 women per year. So a little bit over 245,000 new cases in 2016 and 164 million women in the United States at that time. 1 in 8 women will have this in their lifetime. So that gives you an idea of prevalence. It's pretty common. 20 deaths per those same 100,000 women per year. So a little bit over 41,000 women out of that same 164 million. Screening. This is pretty well developed in the United States. A lot of women, even some of you as my students, might know about the mammogram. And it's essentially an X-ray of the breast. And there's a little bit of controversy with this, and I'm not putting anything up here to inflame opinions. The screening guidelines have changed a bit, and we'll pick up